Good morning. Today is Wednesday, August 26, 2020. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety and with the Unified Command effort for the state of Utah COVID-19 response. I'm happy to welcome Governor Herbert today for our weekly briefing. He will be joined by Dr. Anegla Dunn from the Utah Department of Health, Tami Pyfer, his Education Director, and a few special guests as well. So we'll turn the time over to Governor Herbert.
Well, thank you, Joe. It's good to know that I'm not the only one that's lost a month in all this excitement we've had with the pandemic. Let me again welcome everybody here. We're honored to have our weekly briefing with you today, and thanks to the media for covering this. We appreciate the efforts of many people to make sure that our people of Utah know what's taking place and what the facts are regarding this pandemic. We're entering a new stage right now, as most of you know, with the schools opening up. We have 40 of our 41 school districts who have opened up and welcome our students back into class, K through 12. And we're going to have a report on that a little bit from Tami Pyfer, Education Director, but it's gone very well. People are excited. The students are happy to be back in the classroom. They've had a long absence, not seen their friends and their teachers. They are excited, I think, go back to a learning opportunity. They gather up their lunch pails and their books and their masks, and you can tell by their smiling eyes that they're happy to be back in school once again. So we appreciate all those who've made that possible. It's a little different. We know that. It's different than what we've been used to, and we're going to ask people to act a little bit differently. Wearing the mask, although not always convenient, is certainly an important part of keeping people safe. The medical advice and the science tells us that. We also are concerned about our teachers, making sure that they have a safe environment as they find themselves in a more vulnerable classification as more elderly, young, but still elderly, more so than the students. And we want to make sure that they feel safe. So we're encouraged about what's taking place, and we appreciate the school boards, the superintendents, the principals, the teachers, the parents, and the students all working together to get us to a good place as we start this new school year. Our students, I think, are teaching us by example. That we're seeing how resilient they are, how they're willing to, in fact, make adjustments and adapt to what is a very difficult and challenging situation with this pandemic. It's not easy. In fact, it's hard. But they're leading the way for us. And again, I think the schools this week have shown, the students have shown that they're prepared to do what's necessary. To wear a mask and to keep their physical distance appropriate and have school continue on, not only academic activities, but also extracurricular activities. So it's going to be my pleasure to introduce some of our future leaders, current leaders in their school, and taking a stand and being wise beyond the years, I believe. So I want to introduce to you Dallee Cobb, Dawson, Thelin, and Broc, Gardner. They're all seniors at Enterprise High School down in Washington County, and they have something to say to not only the local community there, but to all of us across the state. So Dallee and Dawson and Broc, are you there?
Yes, I'm here.
All right, we'll turn the time to you. You're on.
All right, thank you. We're grateful to have this opportunity and to be speaking out as students and to finally be part of the conversation. It's really awesome to be here, and our voices are being heard, and it goes to show that even though we're kids, our voices aren't irrelevant. What we have to say matters. Just in the past week, we've seen how much coming together as youth and really expressing how we feel can affect our community, and just getting our ideas out there, especially in the face of so much opposition from a lot of adults and parents. We got a lot of media attention over a speech that was given at a football game by myself and some social media battles that these two took on themselves and did awesome. So I'll just talk a little bit about that speech and why I gave it and how I ended up being there. We just heard some rumors about some parents in our community and surrounding communities that were not really agreeing with the mask mandate, and which is understandable. People are going to have different opinions. but we felt that our senior year, and especially just the school year in general, was being threatened, especially because this is such a great opportunity and really a privilege to have. I mean, just look around, a lot of the neighboring states don't even have this opportunity to be in school, to have sports, and that is something that we are so lucky to have. And so that almost broke our hearts a little bit because we want to be here. We want to stay. And even though we hate wearing masks, like, I don't enjoy it. It's annoying. It gets hot sometimes. It's not fun. We don't like doing it. We're going to do it because it ensures that we can do all these different things that we love, that we can participate in sports and be around our friends, which is really, school is more about socializing and learning how to be your own self rather than just education. I feel like, especially for me, I love being around people and discovering who I connect with or what I can do to better myself rather than just learning in classes. And I think that's something we've really missed over this whole COVID-19 thing, is that school is more than just education. Like I've said, having it in person is so important. I just want people to understand that the opportunities that we have here to be in school in Utah, we're so fortunate to have that. And we shouldn't be throwing away the opportunity to be in extracurriculars and to be in person and socialize over something as small as wearing a mask. I mean, everyone can do it. It's uncomfortable. No one likes it. We understand that. But in order to have all these things, we've got to be able to make the sacrifices for it. And I feel like the opinions of parents and adults in general right now are just a big part of that problem. We're not willing, as students, we're not willing to work with the community if they're just going to go against what we want. And that's upsetting. So we just ask one thing: don't take away what we want, especially if we're the ones willing to do the things that it takes to have it. And that's all I have to say. So.
And I think that Dallee put that perfectly. For us, we just wanted the parents to know that we need our voices to be heard, and we have had our voices heard. And we're all in agreement that we just want to be able to attend school. For us, like she was saying, school is something where we want to socialize. It's where we can be with our friends. It's where we can enjoy our day. That's where so many kids, that's where they feel safe, is at school. And so because of that, we wanted to be able to be in school in person, not have to do it online. And so we just wanted to wear masks. It's just one small thing. Yes, it's not easy, but it's one small thing that we can do that makes it a lot easier for us to be in school. And we just want to follow the rules that are set in place. And the part that I played in this, I was on Facebook. It was where the controversy started, was on Facebook. There was a post that was put up where people were trying to protest masks, but the problem with it was the parents were putting their agenda on the kids. That's the part that I did not enjoy the most, was that the parents were trying to tell their kids not to wear masks to try to protest this, which I'm all for protests. I'm all for the First Amendment and the right to protest, but I don't feel that the way that they were doing it was the correct way. I don't feel that telling your kids to break rules that are set in place is the right way to protest. And so the part that I played is I put a post out on Facebook, just a small post. I wasn't looking for any recognition or anything, but I just put a post out just telling the parents that us kids, we just want to be in school. We want to be able to enjoy it and to be able to have our sports and be able to be around friends. And wearing a mask, yes, it's something that's not fun to do, but it's not that hard. Just wearing a mask for the entire day. We're doing it right now. Yes, it's not easy. We're speaking and it's kind of hard, but it's better than being at home. It's better than having to be stuck at home. So that's what I just wanted to share with the parents. And I feel like it kind of swayed their opinions on a little bit because they kind of realized that us kids, we have our own voice too, and we just want to be able to enjoy our school.
Yeah, so what I did was I wanted a place where people could share their support for our movement of wearing a mask. So I put something on Instagram, and I encourage people to share it on their Instagram stories to just show kind of the whole community that they supported this, the kids, that's what they wanted, to try and, I don't know, just go back at the narrative that was being pushed before. So that's my part in it.
Yeah, that's really just our message, is that we want to be here, and we don't want parents to be pushing this agenda that it's not fun to wear a mask for kids, so we shouldn't be wearing masks, because we're willing to do it. We want to be here, and we're willing to make that sacrifice, and that's not the decision for the parents to make. That's not the decision for adults to make. because you don't understand how much it's important to us. School's our lives. I mean, we come here, we do work at school, we go home, we do homework, we go to practice for our school sports. It takes up a lot of our time. This is our lives. We don't have other things to worry about. And so that's why it's so important to us, and that's why we're speaking here to you today, to really just call attention to that. And so we just ask everyone, ask your kids how they feel. Ask them if they're willing to go to school and wear a mask, because I guarantee you'll be so surprised with their answer. That's all we have to say. Thank you for having us.
Yeah, thank you.
Well, thank you to Dallee, Dawson, and Broc. Thank you. We appreciate your courage. We appreciate your wisdom. And speaking for the young people of the state of Utah, I believe that if we can do it down in Washington County where it's 110 degrees, we can do it anywhere in the state. So thanks for your leadership. We'll excuse you now to get back to class and enjoy your learning experience down there. We want you to have the best experience possible under these difficult circumstances. So thank you for your leadership and sharing with us today.
Thank you for having us.
Good luck to you. Say good luck to all the student body for us too.
Will do. Thank you.
Thank you. We all understand the importance of education, I think. Not only does it help us prepare for college and post-high school educational experiences, but it helps us prepare us for life. It helps to be a good citizen. And we see this example here today of our young people stepping up and being good citizens and showing wisdom beyond their years. So I'm very impressed with our young people. Education is a key issue, and now we're opening up now our schools as we start this school year. So I've asked Tami Pyfer, who's our education director, to come and give us a brief overview of what's taking place today in our 41 school districts. I think 40 of them opened up by today now. So we'll ask Tami to come in here and give us a kind of an overview of our education.
Thank you. In January of this year, we held the Governor's Annual Education Summit. And our focus this year, or in January, was on what we could do throughout this year to improve and increase the social and emotional learning that was happening in our schools, ways that we could help teachers and students develop these skills. And little did we know at the time how important that focus on social and emotional learning would be. And as students have started to return to the classroom both last week and this week, we've really been encouraged by the activities and the environments that we've seen in schools that teach and integrate these social and emotional skills. And when I say social and emotional skills, I'm talking about things like managing stress, building relationships, teamwork, respect for others, developing a sense of confidence and optimism, negotiating conflict, perspective taking, empathy, and resilience, something that the three students really have just demonstrated for us. I just want to give you a couple of examples of what we've seen happening. In Tooele District, the Willow Elementary students were welcomed back by bulletin boards that had student artwork, and then across the top the phrase that we are strong together. We are stronger together. Choose Kind ambassadors met students at the door at Mountain Creek Middle School and Jordan School District. And in Iron County School District, they launched their theme for the school year, which is Face Everything Together and Rise. A teacher in Davis posted this on social media yesterday. She said, the first day of school was amazing, and it was wonderful to have kids in our building again. We've got this. Parents in Washington District sent their students to school with masks and treats for the teachers, both a show of support and respect. One principal posted this on Twitter. Loved seeing our kids today. Hashtag best day 2020. I spoke with a parent of a third grader in Orem who was not comfortable sending her son back to school yet for in-person instruction. And she said, we decided to start the year with online instruction. The teacher visited our son at home and has been great to stay connected. We are especially thankful that we have the opportunity to return to the classroom as soon as we feel more comfortable with that. It wasn't an all or nothing choice for the school year. And finally, this was a note I received from a curriculum director at a charter school in Clinton. She wrote, the first day of school was crazy and amazing. There were some tears, but those were mostly mine. And we left exhausted, but in a good way. The students were happy to be back, and they adjusted quickly to wearing masks. Our support staff pitched in anywhere and everywhere to make it all work. She said, we had some glitches with our online instruction, but got it worked out. Is there some apprehension about getting sick? Yes. But we have been lucky to have a supportive community. Everyone, students, parents, teachers, and staff are braving new territory with patience and grace. It's going to be a great year. These are just some of the comments that we have heard and that we've seen posted on social media. And the school openings certainly have not been without challenges. There's some bumps, some miscommunications that we've even handled at our office, major adjustments and minor adjustments. But we've been encouraged that for the most part, the feedback that we've gotten has been overwhelmingly positive. Teachers miss their students. One teacher posted that he got a lump in his throat as he walked in and his students returned to school that day. And students miss their teachers and they miss their friends. They're eager to learn, and our community is pulling together and working very hard to make this succeed. So we'll continue to plan, adjust, adapt to new circumstances, and just keep doing the best that we can. One last thing that we've seen our teachers sharing on social media is this year's must-have school supply list, and it reads like this: patience, flexibility, deep breaths, humor, cooperation, encouragement, understanding, compassion, respect, and kindness. I feel like we're off to a great start for this school year. Thank you.
Well, thank you, Tami. We appreciate the work of so many, have worked to open up our school year. You've heard from some students. Our teachers are doing just a great job of preparation and anticipation. Superintendents, our local school boards elected by the people, our state school board, all working together in concert to help us to have a significantly positive experience here this school year. So we thank everybody involved in this. With that, let me just mention a couple of things. And one of the things that has been an ongoing discussion point is testing. We had Nate Checketts from our Department of Health here last week talking about testing and answering some of the questions that we have regarding testing. Testing is a focus we've had. We've been very good at in the beginning. We had a lot of people getting tested more proportionally than other states. It's helped us get a leg up on tackling this pandemic and the coronavirus. We understand the importance of, along with augmenting testing, is wearing the masks when you cannot social distance, proper hygiene, all the things you've heard over and over and over again ad nauseum. Testing gives us an opportunity, though, to find out who has the coronavirus and to give them guidance on how to get through that challenge when they're sick. We can help to isolate them so they don't spread it to any other people. Our contact and our tracing efforts are enhanced. Again, efficiency would require us to have testing. And yet our testing has gone down in numbers. Let me just encourage everybody to please get tested if you have one of these symptoms. If you have fever, if you have cough, shortness of breath, sore throat, muscle aches and chills, or a decreased sense of smell or taste. If you have any of those, one of those 6 symptoms, it probably would be wise to get tested. If for no other reason, to get peace of mind. We know that most of you won't have the COVID-19, but at least you'll understand, and if you do have it, we can help guide you through that process and help you not infect other people. So today I'm going to do a similar kind of a thing. We're happy to welcome back Dr. Dunn, our epidemiologist here for the state of Utah. She's been a stalwart from the very beginning on this issue, an expert in this kind of infectious disease with this virus, and we were happy to have her come back and have her talk a little bit about not only just give us the weekly report, but also to talk to us about some of the questions that we have that people have been inundating us in the Department of Health with, so we'll try to get some clarification there as we have that opportunity. So please welcome Dr. Dunn back. Welcome.
Great, thank you, Governor. I'll start out with just a brief situational update. Our 7-day rolling average today is 376 cases. The governor set a goal to be under 400 cases a day by September 1st, and we've actually been under 400 per day since August 11th. And our 7-day rolling average for percent positivity is now at 8.6%. And we have had, unfortunately, 401 deaths due to COVID-19 during this outbreak. So as we reach the end of August, I think we all really need to be proud of what progress we have made and where we're at. At the beginning of this month, our 7-day rolling average was over 500, and now we're under 400 cases per day. And our percent positivity at the beginning of the month was hovering around 10%, and we've dropped that nearly 1.5 percentage points. And we now have about 100 fewer people currently hospitalized due to COVID-19 compared to the beginning of August. I'm confident that we can continue moving in this direction. Let's stay committed to doing what we know works. Wearing a face mask when we're in public, staying home when we're sick, washing our hands, and practicing physical distancing as much as possible. And with that, I believe we have some Q&A.
Yes. Thank you. And again, we'll just social distance here. And let me ask you, I've talked about testing. We get a lot of questions about why are the numbers of testing going down? The percent, our positivity rate seems to be staying about the same. You've talked about 3% being a good goal to get to. Tell us the relationship between the number of tests, why are the tests going down, and our positivity rate.
So we have seen a drop in the number of people getting tested every day. And this could be due to people just not being sick and not having symptoms. And this makes sense given our low case counts as well. So we were having our highest testing numbers when we actually had our highest number of cases, indicating a greater spread of COVID-19 throughout our communities. So it could be a really good thing that our testing numbers are going down. However, given that, we still want to make sure, and I want to reiterate what Governor Herbert said, we have the capacity in the state to test anybody who needs it. So if you have one of those 6 symptoms or you're a close contact to a confirmed case, we want you to get tested. With regards to the percent positivity, this is certainly one of the primary metrics we look at to indicate how we're doing in terms of controlling the pandemic. 3%, that's been quoted a lot, isn't some magic number. We are certainly heading in the right direction. Our percent positivity is decreasing, and that indicates that we are doing a better job at controlling the spread of COVID-19. So really, for us to continue to have a handle on this, we need to encourage everybody out there who is symptomatic or a close contact to a confirmed case to get tested.
Dr. Dunn, along that same line, we've talked about the positivity rate. We also here talked about the transmission rate, which I think is pretty important. Why don't you explain to us what the transmission rate is?
Sure. So something we follow in public health with regards to infectious disease outbreaks is something called the transmission rate. So for every individual infected, how many people are they likely to infect? And for us to be controlling the outbreak, we need that number to be less than 1. And we are just under 1 or right around 1, and we've been there for several weeks. And that indicates, as we've seen, a decreasing in the number of cases. So we're certainly on the right route right now.
Talk about, we have people, okay, sorry. What about the cost? I mean, we want more people to be tested. Is it going to cost them a lot, $50 a whack to get a test? What is the situation on cost?
So for the vast majority of people out there, if you have to get tested for COVID-19 because it's medically necessary, meaning you have a symptom or you're a close contact, it is free. That means you should not be charged a copay, any payment at the time of getting tested. That should not be happening. There are some people out there that are requesting tests for non-medical reasons, such as needing to travel or employment reasons. Health insurance companies are not obligated to cover those tests. If you feel like you have been charged for any COVID-related care unnecessarily, we do have an email address that you can reach out to. That's COVID-19 testing coverage at utah.gov. Again, COVID-19 testing coverage, all one word, at utah.gov.
We have the positivity rate and the case numbers, which has been kind of at the forefront. What are some of the other metrics that we ought to be watching closely to see if we're winning this battle against the pandemic?
From the beginning of this outbreak, our primary goal was to protect hospital capacity. And we've been able to do that here in the state of Utah through a great collaboration with all of our healthcare partners. And so that's something we're still putting on our primary metrics that we look at every day. We want to make sure that we have enough hospital capacity, both ICU and non-ICU beds, to take care of COVID and non-COVID related sicknesses and illnesses. And we're under 50% for both of those metrics for all illnesses. And COVID only makes up, a small fraction of the number of beds being taken up by for ICU beds and non-ICU beds. So that is certainly, in addition to case counts, percent positivity and transmission rate, hospitalization capacity is still something we look at.
Last question, Dr. Dunn. We've invited people, we've tried to have open and transparent numbers out there and information regarding the pandemic and the coronavirus. We have a webpage, coronavirus.utah.gov. You can go and get probably more than you ever want to know about the pandemic. But the question that keeps coming, can we trust the numbers? Somebody in the back room trying to figure out what we ought to have as numbers and making that the outcome as opposed to legitimate numbers and transparency that we're putting out to the public. Can we trust the numbers?
So our data comes directly from laboratories to the Department of Health surveillance system and right on to the website. So we have a lot of confidence in those numbers. And we at the Department of Health hold ourselves up to the highest integrity when it comes to reporting data. That is one of our primary missions, to make sure that the public has accurate data. And we do that. If you look on our coronavirus.gov website, we've been transparent throughout this outbreak. And we actually have more data on there that's available than a lot of our other states here in the US. And so it is something that I am really confident about, and can assure you that it is accurate, all that data on there.
Well, thank you, Dr. Dunn. We appreciate your work and your service, and welcome back. I know you had a nice vacation up in the mountains, and now you're back to the grindstone. So thank you for helping us out. Let me just finish on a positive note here. Utah is moving in the right direction. It doesn't mean we're perfect. It certainly doesn't mean that we're close to the finish line. This is no time to say it's good enough. In fact, we need to redouble our efforts. With us getting back with school, we're going to have more social activities and gatherings, more dense populations getting together more than ever before. We need to practice the advice that's been given to us by Dr. Dunn and many in the medical arena, and those who are scientists, saying wear a mask, social distance, wash your hands. Please don't go anywhere if you're sick. And be extra careful. And if we'll do that, we're going to continue to progress in a positive way. The good news for us is I've listed down 5 things. 1, our economy, which has never been shut down like other states, is showing signs of growth and prosperity. The Department of Labor statistics came out last Friday. Our unemployment rate is at 4.5%. 4% normally you think in terms of full employment. We have many jobs out there that are wanting right now in spite of the pandemic, but they just lack people that have the skills. That's again why it's important for us to have school and get that education, K through 12 and post-high school education. Again, our economy is doing well, the best of any economy in the nation today. 2, we see the private sector stepping up. They recognize they want to create a safe environment for their customers to come and shop. So I appreciate the chambers of commerce throughout the state, headed up by Derek Miller here in Salt Lake City, that has a stayopenutah.com webpage where people can sign and take the pledge to stay open by staying safe. As we work together in this regard, wearing masks, and many stores now requiring you to, if you're going to come and shop at my store, we request respectfully that you wear a mask to help limit the spread of the coronavirus on the off chance that you might have it. Again, the private sector stepping up. We have over 1,500 businesses who've taken this pledge now and growing. And we appreciate the private sector stepping up and doing their part. I'm pleased to see the 7-day average. You've heard Dr. Dunn talk about, we're about 370 on a 7-day rolling average right now. And that's good news because it's been everybody working together, a lot of volunteer work as well as mandatory work when it comes to the wearing of the mask. We appreciate the work of many that's helped us. And then people just being a little more cautious, a little more careful. How you conduct your life and how you go about your business is important if we're going to slow down the spread of this virus. The hospitalization rate, again, has dropped dramatically. Right now, COVID-19 patients are only using 9% of the ICU beds. That's been almost cut in half from where it used to be. So that's a good sign when it comes to making sure we don't overwhelm the hospital and the healthcare system. And our ICU beds now, 9% is what have COVID-19 patients in them. Only 2% of the overall bed space. And we're only utilizing about half of the beds that we have in our hospitals. So we have significant headroom, which is where you want to be in case we have a surge or something that happens, a breakout someplace here throughout the state. So hospitalizations continue to fall, and that's really great news. Let me just tell you, too, I'm encouraged. I've talked with our medical advisors and our experts here in the state of Utah, as well as the FDA, Commissioner Hahn. There really has been an all-hands-on-deck effort to see if we can develop a vaccine. What we're going to be doing in a year's time is what would normally take 3 years to get a vaccine approved. And we have, by most accounts, we're just months away from having a vaccine. Now, I don't want to say something that gives you hope that's not true. We'll know probably by the end of this year how things are working with the FDA. And most people think by the end of the first quarter of next year, we should have a vaccine available and then starting have the opportunity to distribute that to people who want to have the vaccine, which is going to help us get back to normalcy. So I like the trend. I like the position that the state of Utah is in when it comes to protecting people's health, helping us conduct ourselves so that we don't spread the coronavirus, and also opening up our economy so that livelihoods are being protected as well as lives. Our mortality rate is the lowest in the nation. And so, again, we're doing some things very well, but we still have need to redouble our efforts. Let me just, as we turn time now for questions, let me just remind the media in particular, we will have a press conference tomorrow, which will be done in Spanish, habla español, and Lieutenant Governor Cox will be here. He speaks Spanish, and so he'll conduct that tomorrow. So we'll have one for our Hispanic friends and neighbors here in the state of Utah. With that, we'll take a few questions. We've got about 5 minutes before we have to leave.
Good morning, Governor. It's Sean Means from the Salt Lake Tribune. A question possibly for Dr. Dunn, but Health Department recently dealt with a lab that was reporting artificially high on positive tests and artificially low on negative tests. My question is, why 6 months into this are these kind of problems still happening, where there's discrepancies in reporting like this? And then secondly, the study last week from the University of Utah and ARUP about the efficacy of saliva tests, is that going to make tests easier and more available, being able to use saliva tests?
Saliva tests. Dr. Dunn?
Sure. So earlier this week, I just want to clarify, the data is real. All the data we've received is real. We have real positives and real negatives. What happened earlier this week, at the end of last week, was that we had a reporting delay from one of our large partners that resulted in our test results looking artificially low because we hadn't received the negative results yet. That has since been fixed. As you can see today, we have a lot of test results that have come in, and so that backlog has since resolved. And so all of the tests that have been conducted in the past week are now in our surveillance system and on the coronavirus.utah.gov website. So I hope that clarifies that question. And regarding saliva tests, I didn't hear your exact question, but I do know that our partners here in the state are working vigilantly to try to get saliva tests on board. We are all eager to have a test that's less invasive but is accurate so that we can increase accessibility and timeliness of COVID-19 testing in the state here.
Thank you.
Thank you. Next question.
Yes, this is Jacob Klopfenstein with KSL.com. Question for Dr. Dunn. I know you just mentioned that there's a lot of data available on the dashboard already. Obviously, we're really grateful to have that available. But I am wondering if there's a plan to provide a little bit more data about schools and, cases that are being seen in schools, or more information about outbreaks in schools, or anything like that as the schools are starting to open up here?
Yeah, absolutely. We already have the framework built, and we're evaluating that with our public health and school partners to make sure that the data feeding into that framework is accurate. You know, schools just opened, and this is a whole new surveillance system. So before we start publishing that data, we want to make sure that it is indeed accurate and useful for the public to make their own decisions and be aware of what's going on. So that is coming.
Thank you.
I'd like them to talk along the same line about the standards that have been set up in place, and then the plans that each district has done in trying to follow those standards. All the plans are not the same. And I know we've had some concerns, but if we have somebody in a classroom that shows up with the COVID-19, we quarantine the whole class.
I will start this response and then hand it off to Dr. Dunn. So each school had to put plans in place that were turned into the State Board of Education by August 1st. And each school, the charter and schools in the districts, were given the school reopening plans that were put together by the Department of Health. The schools are each assigned a health officer, a public health officer from their local health department, and they work in conjunction with that health officer to determine what happens if a student tests positive, if the whole class is quarantined, if they do contact tracing first to determine who is quarantined, and I will let Dr. Dunn explain the specifics on that, but there are plans in place. And each school district has their own individual plan that are under the umbrella of the statewide guidance. Dr. Dunn.
Yeah, so as Tami mentioned, if a case is identified and that case is identified to have been linked to a school, public health does their normal contact tracing. So they work with a school to identify all close contacts and recommend quarantine for those close contacts. What's unique to the school setting is the idea of recommending that individual classrooms all go virtual or whole schools go virtual. Right now, our recommendation is that those conversations begin when 3 active cases are identified at one time in a classroom. That classroom should start considering to go virtual for 2 weeks. Or if there's 15 total cases within a school or 10% of their population, whichever is lower, if there's 15 active cases within a school setting at one time, the local health department will work with the school to determine if going virtual for 2 weeks is necessary to stop the transmission of COVID-19 in that setting.
Okay, next question.
Hi, Governor. It's Ben Winslow with Fox 13. There's been a lot of demonstrations across the state lately over your mandate for masks in K through 12 schools, and I wondered if you were planning on granting any exemptions for that, or if the mandate remains in place, and what are you thinking about higher education with Provo contemplating a mask mandate, passing one, and then the mayor possibly vetoing that?
I think the policies we have in place right now are good ones. They're based on the best science, the best medical advice, common sense, what it's going to take for us to, in fact, slow down and stop the spread of this coronavirus. We may not get to the finish line until we have a vaccine, but we can certainly minimize the impact and minimize the risk factor. There's no such thing as zero risk. I understand people that don't like to have government mandate them to do things like wear a mask. And to those folks, I'd say, yeah, don't do it because the government's mandating you to do it. We only have a few places where that's happening. Do it because it's the right thing to do and you care about your neighbor and you have respect and you want to make sure, like we heard from our young people today, that things can go on and, in fact, improve. And we see that happening here in the state of Utah. It's not that it's been perfect, but we're moving in the right direction. So if it ain't broke, don't fix it. So I like where we're at. What people do in Provo, that's a local decision to be made. I understand that it passed unanimously by the council, and I guess they'll have to work with the mayor if the mayor decides to veto that. I would think that's probably not the reflection of the people of Provo, but that's a decision that will be handled at that local level, which is where it should be handled. One more question.
Yes, this is Wendy from Deseret News. We've seen data from Salt Lake County on how officials there believe the mask mandate has helped slow the spread of disease. What is the explanation for other areas of the state that are also seeing drops in those numbers?
That's a great question. I think it has to, and I'll let Dr. Dunn kind of sum this up too, but I think people's behaviors are changing. It's really about how people act. Do you wear a mask when you're inside a closed building or not? Do you, in fact, careful with your social distancing? Do you watch carefully how your hygiene is and washing of your hands on a regular basis? You can make it happen by government fiat, or people will do it because it's the right thing to do. And I think we're seeing in other counties and other areas where people are just doing it because they understand it's an appropriate thing to do to keep themselves safe and keep their neighbors and family members safe.
So I don't have much else to add to Governor Herbert. I mean, the statewide decrease is certainly encouraging, and we know that people have changed their behaviors in terms of physical distancing, staying home when they're ill, and wearing a mask. That really helps us decrease the spread overall. So just need to keep it up.
Thank you. Let me just conclude here and say we thank everybody for their cooperation. As I've said in the very beginning, and I'll say it again, we have a good plan in place. It's come because of the best minds we have in the state of Utah working together to come up with a plan of how can we get through this pandemic with minimal casualty. And we appreciate the efforts of so many people. But it only works if we all play our part, if we all do what we can. If we all do a little, we'll all do a lot together. And that's really what's happening here in the state of Utah. And I recognize some of the objections that people have out there, but we're not asking you to do much. There's minimal sacrifice involved in having to wear a mask. We're not asking things that are really hard or difficult to do. Again, our young people taught us today, they're willing to take that little sacrifice so that the schools stay open, so they can have activities, not only in classroom, but after school extracurricular activities. That's the attitude of most all of our students across the state. We, the adults, ought to follow that lead and have that same kind of a positive attitude. Give what little sacrifice we need to do for the good of the whole. That's the Utah way. Thank you very much.
All right, this will conclude today's briefing. We appreciate all of our interpreters in Spanish and American Sign Language and all of those who provided technical support today. We are excusing all of our special guests and our speakers today. So thank you, and we will talk to you tomorrow in Espanol. Thanks.